Thank you so much to everyone that joined us. Again, my name is Sharinda Williams-Simmons. I am the communications lead at Morehouse School of Medicine's National Center for Primary Care and the Health IT Division, which houses Highbridge Solutions. We would like to welcome you to the Health Information Exchange, the Advanced Human Network webinar. And without further ado, I would like to turn over this presentation to Highbridge Solutions and Yetra Bellamy. Thank you so much.
Thank you, Sharinda. Thank you, everyone, for joining us this afternoon. I'd like to just go over who is Highbridge. A lot of you probably know us, formerly known as Georgia High Tech, but Highbridge Solutions is located on the campus of Morehouse School of Medicine, National Center for Primary Care. Carmen Hughes is our Executive Director. Dr. Dominic Mack is our Executive Medical Director. We are state funded to provide resources to help providers in the state of Georgia to promote interoperability, formerly known as meaningful use. We partner with the Georgia Department of Community Health, Alliant Health, and numerous community and professional partners across the state of Georgia. And last but not least, we connect with GaHIN, which we'll hear from them today. So very excited about that. So today's panelists, we have Ms. Pam Matthews. She is the Executive Operating Officer. Sherelle King, Marketing and Outreach Specialist. The one and only Liz Hanson, our Senior HIT Specialist. And of course, last but not least, Paige Stover, Office Manager for Lawrenceville Family Practice. So today's webinar objectives, we're going to provide an overview from GaHIN, the state designated HIN, Health Information Network. We're going to review Highbridge Health Information Exchange, discuss the benefits of interoperability to clinicians, and share a use case study for Health Information Exchange. So with that said, I'd like to turn it over to GaHIN for their presentation.
Good afternoon, everyone. Thank you all for having us. My name is Sherelle King. I am the Marketing and Outreach Specialist at Georgia Health Information Network. You'll also hear us referred to as GaHIN, and we'll just dive right into this presentation. So again, we are GaHIN, Georgia Health Information Network, and we are dedicated to creating a healthier Georgia through the use and exchange of electronic health information. We have a specific focus on advanced patient-centered healthcare. We aim to, of course, increase efficiency for all of our partners, and that will overall improve the health of the state's entire population. So I won't read this off word by word, but our mission is pretty much, to sum it up, it is to facilitate a statewide health information network, and that is through the secured exchange of information. Our vision is to create a healthier Georgia, and our purpose is to close the patient information gap, electronically, of course. So here you see an infographic, and it makes it really easy to explain exactly what we do and how this whole thing works, so to speak. So you see Georgia Health Information Network in the center of this picture, and all of these other different entities that need to exchange information with one another. So with us at the center, we provide products and services that allow for all of these different entities to exchange securely health information. So we do have a federated hybrid model. So we're not a central repository. So that's just a really fancy way of saying that we're not storing patient information. We're just a vessel for how one entity would get information to the next, but we're not storing the information. So patient information remains with the treating provider, and it only flows through us when there is authorization. So now we'll get into some of our products and services. So the first product that we use is Georgia Direct, and I'll give you more information about what it is and how it works. You'll even get to see a picture and an example of what it looks like today. And the other one is Georgia Connected Care. So we'll start with Georgia Direct. It is a basic data exchange, and we have free, but of course, nothing is free. It's just no cost to providers and our users. But it's a no cost to you emailing messaging service to securely send patient health information to other authorized healthcare professionals. It works very much like a GaHIN account, it's not GaHIN, sorry, a Gmail account or Yahoo or any of those emailing platforms, except it is secured, HIPAA compliant, ONC certified. So in 2019, right through August, we've had almost 800,000 transactions to be sent and received using this product. We've had a little bit over 6,000 registered providers, and that is throughout 348 member organizations. So as you can see, these are the numbers through August, and they've already exceeded 2018's total. So Georgia Direct is really a great service that's just been continuously growing throughout Georgia. So we're happy about that. So leveraging Georgia Direct technology, we were an early adopter of direct secure messaging. It is built into a lot of EHR systems as well, but as far as a state or an HIE using this service, we were one of the first. Some of our services have included outreach and training for our providers, ID proofing, working with the HIS, different certifications and XDR implementations. We have about 25 Georgia Direct XDR implementations. And what that is that there's a step further than just setting you up with a Georgia Direct account, but for different systems, we're able to interface this with the systems that they use. Some of those use cases that we have are long-term care. We work with pharmacies and dentists and even the VA, the Veterans Administration Department. So here we have a heat map showing just the many uses of Georgia Direct. You can see that it's spread out all the way throughout Georgia and even close to Tennessee. You see up at the top left-hand corner, we have Chattanooga. So we even have providers that have a Georgia Direct account from there all the way down to as low as Valdosta. So, and the next service that we provide is Georgia Connected Care. It is a little bit more of a robust product. Providers can use their EHR systems to quickly access patient health data from hospitals, physician practices, state health systems, and much more. The much more would be all of the other entities that you saw on that infographic earlier. And what providers have the opportunity to do is to query patient data. The unique thing about this is it does not matter what EHR system they're using. This is a cloud-based service. So if you connect with us, it doesn't matter if one hospital is using Athena and the other is using Epic. This allows for them to securely exchange and pull information from us. In 2019, and these numbers are through August, we've had over 14,000 connected providers using Georgia Connected Care. We've had over 2 million queries and over 34 million, nearly 35 million master patient indexes in our records. So again, these numbers are growing rapidly, just like Georgia Direct, and this is a really great service to use for our providers as well. I do want to make a note, we get this question often, that if you are connected with GaHIN through Georgia Connected Care, does that mean that you have a Georgia Direct address or vice versa? And it does not. So they're two standalone products. So some people are connected with us through both, and some just use Georgia Direct, others use Georgia Connected Care. So there's 3 ways to connect with Georgia Connected Care. Provider organizations that want to participate with using this service to query patient data from us, they have these 3 ways to connect. So the individual provider can connect to an HIE, and that's usually a regional HIE. So this is very important. This is probably the easiest way. If you are a small practice or an individual provider, you would just locate your closest regional HIE, such as a Highbridge Solutions. They are connected to us, so and directly you connect to them, and then you're connected to the entire network and system. So that's the first way. The other way is for a provider to have an EHR vendor that is connected to either a regional HIE or connects directly to GaHIN. And then the third way, which is usually for larger health systems, there are some exceptions here, but it's for the provider to connect directly to GaHIN. So this just shows the different types of agencies and organizations that are connected to us through the use of Georgia Connected Care. We have 5 state agencies. We work very closely with the Department of Community Health and Public Health, but we also have projects with DBHDD, DJJ, so just a plethora of state agencies. We have 5 major health systems that include some of the largest health systems in Georgia, Wellstar, Emory, Grady, CHOA. We have regional HIEs, one of which is hosting us today. Thank you. We have 4 care management organizations. We're connected to different bordering states, including East Tennessee. I'm pulling this from memory. North Carolina, South Carolina are 3 that I know right off the bat. And we have some specialty connections as well. So this map shows Georgia Connected Care as well as Georgia Direct. So remember from the other heat map, the blue dots are the direct addresses, but here we've also added those users of Georgia Connected Care. The gray stars are practices, and the yellow are clinics. The burgundy with the cross are hospitals, and we even have schools through school nurses connected to us as well. So now I'd like to turn it over to Pam Matthews, who will give you more information about the public health registries.
Thank you, Sherelle. I'm Pam Matthews, and I am the Executive Operations Officer, and I joined GaHIN back towards the end of November of last year. So I like to coin this year, 2019, the calendar year, as the year of growth, and growth in terms of adding new services. Next slide. One of the areas that we have worked with, one of the areas that we really have focused on is working with the Department of Public Health with the various registries. Now, already, if you are using Connect, you can already access the GRITS registry. So if you're utilizing the GRITS registry and you're curious, is there any information with the patient that I'm querying, you can access that accordingly. What we are doing this year, though, we're looking at how can we provide value. One of those things that we are currently working on is the actual infamous 3231 form, which is the immunization form for children and other adults. So what can happen is that once you're connected to Connected Care, you will be able to actually access that 3231 form. And we're also working with the school nurses and other physicians in terms of rolling this out so they can benefit from this resource as well. This has gone live. We are doing some testing at this point, and we hopefully will start deploying this more statewide in just a few weeks. Also, regarding the registries, we've already been doing a lot, as I had mentioned, with the state electronic notifiable disease surveillance system. One of the things that we did this year, though, is we went live with a gateway between GaHIN and the Department of Public Health. What that means is that any GaHIN member who would like to do so will be able to use that gateway to actually report registry information. We actually have our first member who went live in September, and it is CHOA, Children's Healthcare of Atlanta, and they are actually now sending birth defects information for that specific registry directly from them electronically through GaHIN to DPH. Also what we are doing is working with Newborn Screening Registry. We, again, have the gateway live, and we are working on that bidirectional connection, which will allow not only members to send information directly to DPH, but DPH will be able to send information directly to the specific member. So we're hoping towards the end of this year and definitely in 2020 to recruit additional members who will participate in this process of submitting their information directly to the registries through their connection with GaHIN. And you can go on to the next slide. We actually already are utilizing direct as in many of these cases with our members to report information. One of those in terms of reporting information to registry is the cancer registry. And we have a lot of success with the utilization of Georgia Direct to report specifically for our members to report specifically to the cancer registry. And it not only has a benefit in terms of savings of time, money, but also of resources. So those resources can actually be deployed and focus on additional tasks that they may need to really focus on and spend more time at within their organization. So again, the registries is one such area that we have really been focused on deployment of electronic exchange between our members and DPH, but we have several other projects that we are currently in process with. One is the Value-Based Healthcare Atlanta Heart Failure Project. That is from the World Economic Forum. Atlanta was selected as only one of 4 sites globally, and the focus is on non-risk adjusted heart failure outcomes and benchmarking. So with this, there is a whole group that is focused on rolling this out. We have project plan and project meetings, and there's a project leader with all the various representation from the metro Atlanta area. GaHIN's role in this will actually be to serve as the benchmarking authority. So this is where GaHIN is actually stepping outside of what Sherelle has already mentioned. In terms of new service offerings, we're dipping our toe into analytics at this point in time, and this is our first entree into that. We're dipping our toe. It'll be a phased approach, and our first phase, which we are actively working on now, is working with the American Heart Association Get With The Guidelines program. We are currently working with Wellstar and Grady, and what that means is that these two members, Grady and Wellstar, will actually use the GaHIN connection to report their data directly to American Heart Association's database for Get With The Guidelines, again, for heart disease. So no longer will they need to do this manual collection and manual submission in some cases, but they'll be able to use GaHIN to actually submit their data to American Heart Association electronically. So we actually are building that connection between GaHIN and the American Heart Association. So where we are, we look at having this project launch around the first quarter of next year, where this will be a live feed. And then to wrap it up, some of the other projects we are actively working on, lab results, we actually are working directly with Quest. And what this means is that we're working with the third-party reference labs, Quest and LabCorp, which has about 80% plus of the reference lab work in the state of Georgia. And what that will mean is that our members who are utilizing Connected Care will also be able to now pull in separately the lab at the from Quest and in the future LabCorp. And then from there, you'll be able to download that information into their respective EHR if that's what the desire is. We are have a live feed right now between request in GaHIN, and we are in the data quality because lab is discrete data, very important, and we're in that data quality aspect right now. We're looking at bringing on medical imaging, where you'll be able to access medical imaging, of course, medication fill, and then also ADT alerts. We currently have a lot of activity with our care management organizations and their utilization of ADTs, but where we are, we're creating a more robust feed, more data elements into that ADT alerting, and also rolling that out to our members. And this just gives you a little bit of description of more about the ADT. And we do have a lot of work going on with our existing ADTs, which is showing a lot of benefit and results, especially with the Division of Family Children Services, especially with foster care. And that should wrap up the GaHIN presentation, and thank you for having us today.
Thank you so much. Thank you so much. That was great information and a great update about the great work that's happening over at GaHIN. I kind of want to bridge everything together and how HighBridge HIE has the connection with GaHIN, which offers the connectivity to the providers. So back in 2014, we established our own regional HIE at Morehouse School of Medicine, connecting to our statewide regional health information network, which you just heard from GaHIN. So also, as you saw, we are one of 4 regional HIEs connecting into GaHIN, and one of the only ones that is open to all who want to connect. We're not limited to geographic constraints or tied to any specific healthcare or health system. And we're open to all EHR platforms as well. Our technology partner, formerly named Liaison Technology, they're now OpenText, is a US-based technology company with international presence as well. They're also located in Alpharetta, Georgia, which gives us, close proximity for meetings and conversations around connectivity. We offer a cloud-based service through the HIE as well. Through HighBridge HIE, we have connections and exchange with independent ambulatory practices, small rural hospitals throughout the state, as well as entities involved in the coordination of patient care delivery. We are excited, so excited, to have brought on 4 correctional care facilities in the state and working to connect several emergency management agencies to make patient data available to them at the scene or at the point of care. Through our HIE, we offer aggregated patient records, medication history through our partnership with Dr. First, performance dashboards, lab and radiology electronic orders and results. Through GaHIN, we are able to exchange with most of the large healthcare systems, as they mentioned, care management organizations, state agencies, like they mentioned, Department of Behavioral Health, Department of Juvenile Justice, Public Health System, just to name a few, and large specialty clinics, as well as the National eHealth Exchange and other state HINs. So the last count that I had when we did this presentation, they represented over 22 million unique patient records. However, we just heard that number is now 34. So great job, GaHIN. So I'd like to kind of go into some of our work that we've been doing. After surveying a lot of our providers in the community, we realized that especially in our rural areas and underserved areas, that they really need to exchange data, but had no one to exchange the data with. So we worked to help to solve this issue with the development of the community health networks. This is connecting the healthcare community involved in patient care, normalizing the data and redistributing at the point of care to referring physicians, other community resources, and the patient in the local community. We have a great partnership with Tangible Solutions that allow us to create these smaller CHNs, as we like to call them, that positively affect patient care in smaller and rural communities. So we enable patients, hospitals, care teams, and other employers a type of virtual collaboration so that they can work together to improve population health and deliver a better patient experience in a more affordable manner. So we like to say we're basically enabling patients to get the right health care at the right time in the most effective, cost-effective manner. So with that said, I'm actually going to pass the baton over to Liz and Paige, and they're going to kind of walk through how does all this work? How does it look? What really is going on with the EHR and the connectivity process? So ladies, take it away.
Thank you, Yetra. If we could go back to that previous slide, just want to do a little bit of an introduction. Do want to introduce Paige, who helps us out with these presentations. And I don't want to say Paige is a guinea pig, but she is an early adopter. And we go to her for almost everything we need to be adopted early. Paige is the practice administrator of a family practice in Lawrenceville. She has 3 doctors, 1 nurse practitioner, and 2 PAs. And what Paige was determined to do was to use technology in the exchange of patient health information, and we've been able to work together. So, Paige, if you would, could you just outline a few of the things that you had as your goal for implementing the HIE in your practice?
Okay, great. One of our goals was for time reduction and the amount of time that our staff was trying to get this information. And I think it was Yetra has spoke about your mission in electronically receiving our information. And so that was our goal, is to get away from making calls, making faxes, multiple calls, multiple faxes, as you know we all do, to receive a medical record, and to utilize this platform to be able to receive this information electronically. And what we found is it not only gives us the patient's diagnosis codes, the medications they were prescribed, lab reports, x-ray reports, all types of information that is really changing how we operate here for getting that information for the patients back into our office.
That's great. So you've been able to implement the HIE with an interface. We're going to talk a little bit about what you can do with that. And we'd like to step through the process that you've used. But first, let's take a look at where you're going to apply that. So let's talk about the need a little bit more. And if I could, I just want to outline a few of the things that we've talked about. You mentioned specifically the speed of information from hospitals, from referrals, new patients walking in. We talk about the accuracy of information. Paige, I believe we're going to talk in a minute about how you used to do it and now how you do it. But anytime anybody is inputting medications, then there's a chance of that information being incorrect. And so that's something that we'll look at, that you don't have to rekey from another provider. I believe it also helps you with your MIPS HIE measure, which is getting a lot of us, okay? So this is, I think, Paige, this is the reason we implemented it in the first place, was to meet all these measures. And then we started seeing that there were truly some other wonderful benefits from it. And then, of course, as the early adopter, you participated in the Transforming Clinical Practice Initiative, or TCPI, where community of care and connected care was so critical in closing the referral loop. So let's take a look at the next slide and talk about the solutions. So Paige, if you could share with us the things that you did to implement the solution.
Okay, so first I want to talk about our interface. It was the first step that we had to take. And then we had some training with GaHIN and with you, Liz, to help us find this workflow and how it would work in our practice. Currently, we have 3 major hospitals that our patients mainly go to, which is Emory, Northeast Georgia, and Gwinnett Medical Center, Northside now. And as we all know, it's hard to get that communication from the hospitals when your current patients go to the ER, much less when you have a new patient present that went to the ER. And trying to get those medical records is very difficult. Another thing that we did is we did utilize the direct exchange. So we able to exchange direct email addresses with our specialists to communicate that way as well, to share our office visit documents with each other, and for continuity of care, closing that referral loop. So utilizing that direct exchange is just as important as the health information exchange portal. You also have to determine your workflows. Who's going to do this? Who has time to do this? And who's going to follow up with it to make sure that you have everything that you need before the patient comes in. So it's training your staff. And then also at the end of the day, not only are we doing this for our patients and our continuity of care, but we're also doing this for our MIPS. And we want to get credit for it because we're doing it. So you have to find your workflows, monitor your MIPS platform, our clinical reporting system that you might have, and making sure that you're getting credit for everything that you're doing.
And that's a good point to bring up because, Paige, we work with many practices, several of them saying that they're doing the right thing, but they're not getting credit. So if you're not getting credit, you might want to visit with us and let us see if we can help you figure that out. Next slide, please. So, Paige, as we went through some of the applications that you had for HIE, and you put together your workflows for each of those applications, I'd just like to point out what some of those applications were. So if you could just share those with us, some of the ways you see when you can use this.
Okay, so we have patients calling to make an appointment. You know, the staff asks them, what do you need to make an appointment for? I just got out of the hospital and I need to follow up with the doctor. Okay, so that's your clue that you need to get those medical records before the patient arrives for their appointment. Referrals. We track our referrals to ensure that every referral that we send out, we're also closing that referral loop and getting that office visit document and medical records from the specialist on return prior to the patient following up with us. Walk-in patients, as far as they're walking in because, hey, I went to the ER, I had a cold, I need to follow up with you. And also, in addition to this, is new patients. You can also use these for your new patients, ED follow-ups, your hospital stay follow-ups, consults, and I understand that there are the correctional facilities are participating, long-term care, rehab, behavioral health facilities. So there is so much wealth of information here, and it's our job to utilize it.
With the whole community. That's great. So the one that we're going to focus on for the example, and we've got screenshots, so we're going to try, if we have time, take you through this process. I do want to first say that we had to clip the sides, the screen separately. So it seems like it's taking more time than it actually would if you were online doing this. So Paige, if you can help back me up on that one, because that was one of my concerns with having all these screenshots is it makes it look a little more complicated than it really is. So Paige, if you would share with us the ED visit scenario, what you used to have to do and now what you do.
So previously, we had the patient call and make an appointment for the ER visit. The ladies that answer the phone then turned around and asked our referral department to get the information prior to the visit so the provider would be able to read through the records and find out what they went to the ER for, what was done for them prior to their visit. But that's kind of where it stopped. So then when the patient presented for their appointment and the medical assistants are triaging them, they are having to look for what medications was prescribed. Was this patient taken off of this medication, say for his blood pressure, and this one changed to this? So an extensive med rec. Was the imaging report included? Was your lab results included? And vitals, everything. And it was time consuming. So now we are able to, and I'll show you in just a few minutes how easy it is to intake this information, and with a click of a few buttons, you're able to automatically reconcile this information in the patient's chart. You're reducing errors, you're increasing, actually you're really honestly increasing the quality of care that you're being able to provide for that patient while you're face-to-face with them, because you have more time to spend with them instead of mechanical, making sure this med rec is right, making sure that one's right. So you have more time at the end of the day to spend with your patients and with less errors. Once we show you, I feel like you're going to be shocked at really how easy it is and how easy I feel like you're going to be able to implement this in your practices.
Wonderful. Next slide. Let's take a look at it. So I'm going to turn this over to you, Paige, and if you will walk us through these slides that we've taken, that would be wonderful.
Okay, so this is an example of, I reached out to Gwinnett Medical Center before they were Gwinnett Medical Center Northside, and was able to set up an automatic report that runs for me every night and sends to me in a secure email of every patient that presented to their hospital that is assigned to one of our providers as considered their primary care physician, and that you open it and it gives you the patient's name and why they went to the hospital. Were they discharged? Were they just there for a mammogram? Were they there for some type of outpatient services, or were they there in the hospital? So this is an important report to get, and hopefully you can reach out to your hospitals and get this report as well. This is what the portal looks like for the Health Information Exchange. It's very easy to get on board here. You reach out to Liz and her team to get access here. And you'll see once you log in, the next slide there at the bottom is where you're going to type in your patient information to be able to search for them. Once you type in your patient's name, it'll populate on the left, the name, you'll see here, and you'll choose the type of document that you want to see. And you'll see over here it says LFP source documents. Those are all Lawrenceville Family Practices documents that we have interfaced with the HIN for them to have all of our information for our patients. On this screen, after you've selected your patient, and you have different tabs where it says summary, documents, and external data, and your demographics. This is where you're beginning to see the information that you're looking for. So you can tab through those to see different things about your patient. Once you open you find your clinical CCD that you want to see, and you open it, this is what it's going to look like. Very clean, very easy to read. You'll see the patient's date of birth, contact information, which is good because not all the time do we have the same phone number as maybe they gave the hospital. So reaching out to those patients, that's important information to have as well. You'll see who created the document under the document maintained by was Emory on this example here. Now on your table of contents, you can see it's categorized, and these are live icons that you can click on so that you don't have to scroll down the CCD. You can actually just click on, say, discharge summary if that's what you want to see, or your vital sign. You can see just your medication, and it'll take you directly to that category at that point. Speaking of your medication list, so we clicked on the medication list, it's populated here for you to see. Diagnostic reports, this is very important for your patients if they went to the emergency room for pneumonia, or they had a CT scan there that had a positive result that you need to follow up on. It is so easy to see the imaging reports here, so these are very important. Here's an example of your main screen here under the external data. You will see that this specific example of a patient, the Health E-Connection, is from Northeast Georgia. You have your Georgia immunization summary. You have some CCDA here from Emory, and then Gwinnett Medical Center, and the rest of them are probably ours. But you'll see this patient went to 4 different facilities, and this information is here at a click of a button, and you as your practice administrators know how long it takes, or how long it would take you to reach out to 4 different providers to get 4 different levels of information. And I'm not talking, usually it's not even same day, it's usually days before the paper gets faxed to X facility, then they finally get to it, then they get it faxed to you, then you're going to import it. So the wealth of information right here at your fingertips is very important to acknowledge. Once you have selected the CCD that you want to choose to download, you're going to click the download icon, and you'll see it's in the HTML format, so it's not really readable, but it's what is required to process in your EMR. when you choose to download the CCD, you want to pay close attention to where you're saving this, because you're going to want to find it once you switch back over to your EMR to import the information. So take note of where you have assigned it to, or where you've saved it to, and provide some information, the patient information, or a date or a time, something that's going to help you recognize that document. Now, this is an example of what it looks like in our EMR. I know your EMR is going to look different, but the functionality is going to be the same. If you'll pay attention here to the top ribbon, it'll say Chart Summary, and we click on the Chart Summary, then we click on Import. Now you've remembered where you saved it at, so you're going to go back there. It's going to open up, and you're going to open the file. And then in our EMR, you'll see there's the data matches. It says the patient data and the chart summary matches, and it'll make sure that you are importing the same patient into the correct chart. And then once you have clicked on yes, you will get a notification in our EMR that says the chart summary imported was successful. Here you are going to upload this into your EHR. So you can see on the imported CCDA, but on the back side also you can see that the CCDA that we viewed in the HIE is in the HIN is exactly the same as what it looks like in our chart. We've saved it. The data is now available for reconciliation. So we go ahead and sign this document in our workflow. And now the patient's here for their appointment. So this is how in our EMR we start a new office visit. It's populating the office visit chart now. It's populating the data. It's consuming the data in this office visit note. Now, one of our CCD forms is we created for our office is called back in the day, Meaningful Use Visit Checklist. So in this CCC form, you'll see the yellow icons that says reconciliation. So in our workflow, everyone in our office knows before they go in to see the patient or before they sign off on the office visit note, everyone has to go here to ensure everything has been reconciled. If it's yellow, that means it still needs attention. So our staff knows to make sure that everything is reconciled before they discharge the patient.
Now, Paige, if I could just ask a question. Yetcha, if you'll slip back to that previous slide, one down. There. This information is all coming from the data that you uploaded out of that CCD. Is that correct?
That is 100% correct, Liz.
Woohoo! Okay, guys, that's the real deal. That has been taken from another provider and uploaded into her system for her people to reconcile. Awesome. Next slide. Sorry, I just get excited.
Okay. So once you click on the reconciliation yellow icon, now this is what it looks like in our office visit note. It's asking you to reconcile this information. So say, for example, the prednisone there that's checked, the patient's no longer on that medication. So we want to check that button to edit or remove it. And you'll see once we have reconciled their medication, you'll see where the arrow is pointing to where it says done. The reconciliation button is no longer highlighted. So this tells the providers and our staff that they have the most accurate information for the patient's medications, the problems list, their allergies. All of that information that was in the CCD form is now in the patient's medical records for them to be able to easily view. Now we talked about we put the information in there. Now it's your job to make sure that you get credit for it. So work with your EMR, work with your vendors to ensure that technically what you just did was closing the referral loop. You brought in information from an outside source and you reconciled it in the patient's medical records. So watch your numbers at least once a week. Watch your numbers to make sure that what you've implemented, you're getting credit for.
Okay, so now we circle back to another example to go through just for the workflow. The slides or would be the same. Is that correct, Paige? That regardless of why you're looking, the process is the same within your system. The workflow is the same.
Yes, no matter if you're pulling in a specialist note, an ER record, admission summary, whatever it is that you're pulling in, our workflow and visually it looks the same.
Very good. And I did add to this one, I could have put it on the other one, that in your defined workflow, you may also include to refer to the PMP aware for prescription drug monitoring if it's something that you need to do for a patient. It's simple to do that at the same time. But this is available for you folks to look at when you get your slides. Okay, so depending on the provider, your CCDs or your CCDAs may be made available through Direct. You may choose to join up with us on the HIE and utilize that tool as well. And I think initially, Paige, you used the Georgia. You used at the time had a different name. We were Georgia High Tech, but you actually signed in originally. You were one of the first providers to implement the GaHIN HIE, and you used it for your meaningful use requirements. You remember that? I do,
Liz.
And some folks could still do that if they needed to, because GaHIN provides a free direct address that's available. Luckily now you have it into your system, but it was a helpful tool when you were transitioning. We do have many people ask us how you get your specialist to send their transfer of cares or their summary of care documents to you after the fact, or after they've seen your patient, or how do you convince other providers that are sending you referrals to do this or use this process. Some practices use a memorandum of understanding, an MOU with referring physicians and specialists, where they actually set up a letter, and we have a sample that we can make available to you that just says we're going to send you information using Direct, and this is what we're going to include. And we expect you to send us back this information using Direct and within this specific time period. So it's just a tool that may be helpful for you. Remember, specialists need your primary care providers. So they may, if you talk to them and explain what you need, they want to work with you because they want your referrals. So we have many different ways. We've talked to you on different webinars about how to accomplish this. We need to close that referral loop. Paige mentioned that, how important it was. And then Yetra, Pam, everybody mentioned our communities of care. So we really want everybody to look at what methodology is going to be best for them to accomplish the same goal, because we really need to be uploading and reconciling this documentation or this patient information. So now we have some frequently asked questions. I don't know that we had time to do all of these and do any that may be coming in from our participants today. And we have some answers on this page, except for that first one. Who does this in the practice? And the reason we didn't put an answer on here is because this varies. Now, Paige, you're at the initial stages of this process. You want to make sure your workflow is good. So I believe in your practice, you're actually taking care of this right now. Is that correct?
For the moment, yes. And but soon this will transfer over to our referral department, which currently gets this information for us, not electronically.
Excellent. And I do want to just give everybody a tip. I have so many practices telling me, I even have providers, just had two so far this week tell me that the other doctors don't know anything about Direct and they don't know what they're talking about. I would submit to you that the doctor may not be the best place to start because they may not know about it, and we wouldn't expect them to. The referral coordinator at that office should know about it if they're doing it, or the practice administrator. So we do suggest that you talk with those folks about how to do it. Okay, so Yetra, Sharinda, I don't know if you guys wanted us to go on to the rest of these, or if we wanted to see if there were any questions out there that we needed to address from our participants today.
We just want to let you know that our next webinar will be, it's still going to be every third Tuesday of the month. Make sure, you register for that, you're sharing the information about it, and also putting your questions in when you register so we know exactly what you all want to know about during our webinars. And with that being said, we had a few questions submitted ahead of time that we wanted to go over and get our experienced panelists' take. So, what are the internal requirements of participating in the HIE?
Okay. So from the perspective of hybrid solutions, if you would like to investigate, do a little research and see if we might provide a solution for you that works effectively in your practice, then you can simply contact us and we will begin the process. There, of course, there's some questionnaire type issues to be determined, and we will need to communicate with your EHR vendor. So if you're interested in the query and download portion, then we will need to work with you individually on how we might go about that. Our biggest obstacle, if you will, is typically the cost of the interface. So that is something we'd like to talk with you about, see what's the most cost effective, see if we have any grant money or any monies available to help you with that. Sometimes we do. But the way to start is to start with letting us know you're interested, and we will pick that ball up and carry you with us across the goal. Your turn, Pam.
Okay, and two products, as Sherelle mentioned, for Georgia Direct, which is the secure email. It's really pretty simple. We have a member agreement, of course, and then once that member agreement is signed, remember Sherelle said it is free to the providers. Then once the member agreement is signed, we start that onboarding process, which is really identification of the secure email address, plus also training, which is very quick. And then also that training will provide an overview of any of the housekeeping items around that. So Georgia Direct with secure email is pretty straightforward. With Georgia Direct. With Georgia Connected Care, a little bit more complex. If you're anyone interested, they have to submit a member application, and that member application is reviewed and approved by the Board of Directors of GaHIN. I will be honest, from my indication, I don't believe anyone has ever been turned down to be a member that qualified and met the qualifications. As Sherelle said, it's typically the larger healthcare systems, the regional HIEs, a few exceptions like DaVita, which is a national healthcare provider, so they have that network infrastructure. Once the application is approved, then of course there's an agreement to sign, so we go through signing the member agreement. Then we will work with our core vendor, who is IBM, and just like with Highbridge, the cost in terms of what happens on the provider side, that cost is incurred by the provider. We don't cover that cost, but we also try to determine what's the quickest, most efficient way to make that connection. And with many of the common HIEs like Epic, Cerner, we already have some groundwork laid for that, so it's not as complex. And actually, we are also working on a project right now to do single sign-on with Azalea, which is another smaller EHR product.
Thank you so much for that answer. It's very informative. I did want to grab this live question from Patrice. It says, when we say query from within our EHR, does this pull in the data so we can avoid faxing, or do we need to download it somehow? For instance, do we get lab results or imaging from the hospital stay and get to bring it into our EHR? I think Sherelle wanted to answer that.
Sure, I'll take that question. I just want to make sure that I understand it, because if it's what I think you're asking, we get that question often. I think that you're asking, does your EHR system absorb the information once you pull it? And the answer is no. We're working on that. I know that that is something that would make it very helpful to providers and professionals who work in the office, but no. So with the direct, you can only send attachments up to 400 pages of care documents, and that would be opened as a PDF file or however it is sent. and then you would then have to put that information into your EHR system. Or with connected care, same thing. You can pull the information, but the EHR system is not absorbing the information into it.
Two more questions. How are the privacy and security of patient health information ensured?
This is Pam. From a GaHIN perspective, that is part of the member agreement that one must sign with connected care. So, and as well as with direct. So those are handled in our member agreements, especially with connected care. It is very explicitly outlined where the members are really responsible for obtaining that consent. Because there is a process that if you do have a patient and they do not want their information to be on the network, there is a process that they can opt out. But for the most part, and we also have, and currently developing actually some tools and resources to help our members with that process. But the consent is handled from a consent perspective at that local level. Then, of course, from a technical perspective, with our core, they have all of the technical precautions and monitoring equipment and security aspects that you run to support a technical network from a security perspective.
Awesome. So it looks like we have a few questions that we didn't get to. What we will do is post these questions on our social media, on our Twitter page, where you can see the answers to the questions that we did not get. Again, we don't want to hold you past the time we allotted. We thank you very much for tuning in and weighing in and listening to our presentation, as well as thank you to our panelists. This was very informative, and we all want to take this information and use it and share it, and make sure you're telling everyone else in your network to tune into our webinars as well. No problem. You all have a great week. Thank you.
Thanks, everyone.